Thank you all for joining us for this important conversation around the lived experience of many Americans in terms of the hardships they face and their interactions with the policies that should provide them with support, at least in theory. Very happy to welcome today our distinguished set of panelists, and we'll begin with self-introductions with Tammy Seltzer.
Good morning. I am the director of the DC Jail and Prison Advocacy Project at Disability Rights DC, which is the protection and advocacy organization for the District of Columbia. We work with people with serious mental illness and intellectual disabilities who are returning to the community from jail and prison, primarily reaching into the prisons to provide pre-release planning and client-centered planning, and then helping people when they come out to advocate to receive the services and supports they need to be successful, and really trying to end a cycle of the revolving door of people with psychiatric disabilities who end up in the criminal legal system.
And next we have Sharon B Church.
Hi, everybody. I am a lawyer with Community Legal Services in Philadelphia. So I'm a legal aid lawyer. I've been there for more than 30 years. And my area of specialty is employment law. At CLS, we represent about 1,500 low-wage workers and unemployed people from the community of Philadelphia. And we deliver services through a model that takes what we learn from representing that volume of individuals and try to lift it up into policy change so we can impact other clients who we don't serve directly as well.
And last, Shelly North.
Good morning, everyone. My name is Shelly North. I'm the Deputy Executive Director for Policy with a group called Coalition for the Homeless, based in Manhattan. I serve out of our Albany headquarters, and I've been with the Coalition since 1987. We work on the problem of homelessness as well as the root causes of homelessness. We're the original Coalition for the Homeless, based on a right to shelter lawsuit that was brought in New York City back in 1979. So we work on a broad range of policy areas, and we also serve 3,500 homeless people a day through a dozen programs. We feed 1,000 people on the streets of Manhattan and the Bronx. We operate a job training program for homeless women. We operate housing. We're the court-appointed monitor of the municipal shelter system in New York City. And we work on housing and public assistance and Medicaid and educational rights of homeless children and law reform issues. Homelessness has obviously been criminalized across the country, so we work on those issues as well.
Thank you each so much for joining us for this discussion, which I know will be quite informative. Today, we're here to discuss the unmet needs in our current policy landscape and how we got here. So to provide some context, in the last half of a century, we have seen a serious diminution of the social safety net in the United States. We know that this has cleavages regionally and also locally in the provision of services to those in the most dire straits, whether that be unemployment assistance, re-entry into the civilian population from incarceration, services for mental health, and other sorts of social safety net policies. At the same time, those at the lowest income levels have seen very low growth in their incomes on average for the past several decades. So in the end, we see more families falling into poverty, falling into social dislocation, and even forced migrations by the way of evictions and other sorts of policies that lead people to be very vulnerable. What needs still exist today? And what are the lived implications for people in this country? In the areas that you're working at, what do you see as some of the most pressing needs from the people that you're serving and attempting to link to services?
Well, I'd be happy to start. Since about 20, 25 years ago, by far the most common reason that people came to us at our office for employment-related help was based on criminal records. And I'm not necessarily talking about people who were released from incarceration, last week or last month or last year, but really members of the community who had decades old convictions or even non-convictions, and were being excluded from employment, often across the board based on background checks. So until recently, that was by far our bread and butter, bread and butter issue, just based on who was walking in the front door and what their needs were. And so that was where we focused our work. However, that changed. And just to give a scope to that, I mentioned we do about 1,500 employment cases a year. That constituted about 2/3 of that 1,500 cases that we do on a whole range of employment-related issues. That has changed as of last year. And I can give two reasons for that I think both come into play. One is, of course, the pandemic. And I think hiring has been so non-existent that the barrier of criminal records kind of didn't matter because there was no work for people to go to. But the other reason is that Pennsylvania became the first state in the country to implement something called clean slate, a concept that we designed and helped advocate for in the Pennsylvania legislature. And that basically provides automated sealing of criminal cases. And so we started in Pennsylvania implementing that law in the summer of 2019, completed all the back cases by last June, and that sealed 36 million cases. So I think that quite a few people who might have come to see us about records did not, because the problem no longer existed. I think some of them will be back as hiring picks up. But as a result, mostly what we've been doing now is unemployment benefit issues. And I'll speak a lot to the issues around the unemployment program as we go on in this discussion.
Shelly, do you want to talk about housing? And I'll add on to some of that.
Sure. So I would just say that in the past 4 decades, we really saw the advent of modern mass homelessness as a result of the combination of changes in policy with respect to housing, public benefits, the persistent and deepening level of income inequality in this country. The beginning of that period coincided with deinstitutionalization. So the first people who were washed out of very marginal housing tended to be former psychiatric patients. However, the problem of homelessness has extended to the point where the majority of people who are homeless in New York City right now are members of families with minor children. Not as visible a homeless population because we do have the right to shelter and they are not literally sleeping on the streets for the most part. But I would say that what we've lost in this period are the purchasing power of wages, obviously. Those have been stagnant. Public benefits have been changed to the point where they don't even bear a reasonable relationship to what poverty is in a family or an individual. The block granting of basic benefit federal program that the Temporary Assistance for Needy Families has made a disconnection between the poverty of a child in a family and the benefit, which often goes to local governments that pay for job training programs that may or may not have any efficacy, rather than to pay the rent. And then we had, starting with and never recovering from, the period of disinvestment in housing in the Reagan era. So today we are living with the unfortunate reality that hundreds of thousands of Americans are homeless on every single night. And absent federal investment in those very things, minimum wage, benefits, and housing, there really isn't an end in sight to that.
And I would echo what's already been said by Sharon and Shelly, a number of those issues. We are not a homeless this project, and yet 90% of the people we serve are chronically homeless. They were homeless before they were incarcerated. Obviously, their homelessness issue did not get better while they were incarcerated. It got worse. Family members move, die. And also families, because of the reasons Shelly cited, are less able to take in other family members than they were before. But I also want to talk about this whole idea of criminal justice reform. I call it the criminal legal system because I don't feel there's a lot of justice there. But there's so much talk about reforming the system, and yet not much action on it, especially not at the federal level. We're digging holes people can't get out of. And one of the issues that's really of great concern that we see every day is technical violations. People are not necessarily committing new crimes. They have a crime they committed 10 years ago, but because of their mental health issues, because of poverty, an inability to get to where they need to go, or a lack of childcare, they're not able to follow all their conditions in the community. And those conditions are a pretty long list. And I don't think a lot of people know that strict compliance is the legal standard, which means you've got to do it 100% of the time and be perfect. Who's perfect? And then we have folks with serious mental illness. So they get the same list of things everybody else has to do. And then they have a list of special conditions on top of that. And research by Jennifer Skeem at Berkeley has outlined how difficult that is. And there's such great focus on whether people with mental illness have taken their medication. It's the number one question that's asked by their probation officer, whatever you want to call that person. And yet that's the least important factor about whether somebody's going to commit a new crime. And so we see people trapped in this revolving door. We had a gentleman with treatment-resistant schizophrenia who had been in and out of the system, jail, prison, for years, and just couldn't get out of it. And they kept adding supervision time every time he had a violation. He'd walk into the office on the wrong day. Oh, that doesn't count. He would walk in and be talking to himself, and because of his disability and I think a lot of his time incarcerated, he couldn't be in an enclosed area with a lot of people. So 5 minutes was the longest time he could stay there. So he'd walk out after 5 minutes, another strike, that doesn't count. It wasn't until we were able to advocate for disability accommodations for him. He went to a day program 5 days a week, knew exactly where he was, call the program as a collateral contact, find out where he is, see him whatever day he shows up, and use a different legal standard, which we had a number of things that were put in place. And once we did that, he never had another violation. He was able to terminate his supervision early. And in 7 years now, he has had no contact with the criminal legal system. And this is somebody, like I said, was for decades just trapped and stuck in that system. And so that's an area where I think we really need to make some change.
One thing that your answers have impressed upon me is how interconnected what we might typically think of as these disconnected issues are, particularly in the policy space. And that leads me to my next question, because many times in our popular discussions, and particularly in the media, people will always speak about the fact that they know, quote unquote, all of these programs exist that are there to help people because they hear certain names. They hear SNAP, they hear TANF, they hear veterans assistance, for example, and they believe that there are a number of programs and that all that you have to do is pick up the phone and that there's immediate assistance for you and your problems are solved. So why have past policy efforts struggled to meet the needs of so many? And I would add to that, and why does the public believe that these programs are more effective than your experience tells you that they are?
I'm happy to start on this one. I would say, a policy vision and a policy reality are two different things. And unfortunately, there tend to be intermediaries in the process of implementing a concept that is turned into a law that then becomes a program at the local level that end up foiling people. So whether it's that you have to document your eligibility, I mean, one of the crazy things we do is require 2 years worth of housing history to provide certain supports for homeless people. Who can document when you're unstably housed to begin with, every place you slept every night for the last 2 years? That's preposterous. Just the fact that government is required to help people find the documentation to prove their eligibility doesn't mean they actually do that. A good part of the advocacy that my staff does is work on getting government to help people with the things they need in order to prove their eligibility for one of these public benefit programs. And in the meantime, they're either in limbo or they're not permanently eligible, they're temporarily eligible. I will say one thing that Tammy mentioned that I think we need to make better use of is obtaining reasonable accommodations for people with disabilities. So many people who are marginally housed and homeless and poor and living on the edge have some kind of disability. And it's a very valuable tool to get government to make literal accommodations for people who have disabilities and can't jump through all those hoops.
I agree with a lot of what Shelly just said. Those are all obstacles that get in the way. Some of the rules, I wonder where they come from in terms of establishing homelessness, chronic homelessness, in order to be eligible for a federal voucher. There's this 90-day rule. So if you've spent more than 90 days incarcerated, you're no longer eligible. And yet, what has improved for that person who's incarcerated? Like, as I said earlier, nothing's getting better for their housing situation while they're incarcerated. And in fact, a lot of people can lose their housing while they're incarcerated. If they're receiving SSI, that gets terminated. So their source of income is canceled. They don't have access to Medicaid in some states, terminate it while they're incarcerated. DC is one of those places that suspends it, but we don't have a local prison. So if someone is convicted of a felony, they end up in the Federal Bureau of Prisons, and you can't keep your Medicaid when you're being moved to other states. So it gets terminated and has to be restarted. So there are just a lot of penalties for people. SSI, once it's been terminated for 12 months, you have to reapply as if you've never received it before, which doesn't make sense to our clients. It certainly doesn't make sense to me either, that we would have to start that process over when you've already been found to have a disability. And we could look at some records to establish that you still are disabled without starting over again. I think that a lot of the processes that are there take too long, just simply take too long. We expect people to wait. Like for SSI, we can start applying for people 4 months, people with disabilities, before they come out of jail or prison. But decisions are taking 9 months or longer. So we're expecting somebody to live with no income, and they've been determined to not be able to work or not be able to work full time, certainly, and support themselves. That just causes a lot of desperation for people. And I think other issues that get in the way in terms of how we've constructed these problems and how we view them as the public, racism has certainly been used a lot to turn people against a lot of these programs, so that they are fine if politicians decide they want to cut it or make it more difficult. That's okay, because the general public, sees this as a program primarily for Black people, even though that's not the majority of people on SSI. We're really talking about a lot of white people in Appalachia, for example. But that's not how it's been portrayed. And so when it comes time, these programs are very vulnerable to cuts and more restrictions.
Thank you for that, Tammy. And certainly the racialization of American policy, particularly in terms of policy for the safety net, is quite important. Sharon, did you have something to add on this question of
Yes.
our belief about this wonderful collection of policies that we have in this country that will help everyone, and the lived experience and reality of their administration?
Yes, thank you. I wanted to speak a little bit about what has happened to the unemployment insurance program, since that is so dominant in many ways right now with the deep recession that we're in. And it's well known, I think, that certainly among the people attending this conference, that UI was originally designed with the idea that it provided support for white male heads of households who were laid off for a period of time until they went back to their jobs, and that no longer at all fits how our economy is structured or what our labor market looks like. So certainly the changing labor market and the lack of change of the UI program has been one issue. And we've seen that particularly this recession, as fewer and fewer people rely solely on W-2 wages, which is what goes into determining eligible for UI. So now you have people who are being maybe misclassified as 1099 workers, or in fact 1099 workers. And so they no longer have the eligibility, or they work part-time or whatnot. But also over the course of the 40 or so last years, there's been a lot of eligibility changes to the bad as well. And in many ways, UI has followed welfare. So for instance, documenting work search is something that's become a much more prevalent thing in recent years. In fact, it was the Obama administration that pioneered some of that. And we are really seeing right now the consequences of changes that were made to the program after or during the 2008 recession, because that was the last really big recession of our lives. And trust funds around the country were depleted. And so certainly urged on by business, many states tightened their eligibility requirements. There's less money for administration than ever, so that makes it harder to get benefits out. And the trust funds were depleted and have had to be revived over the last decade. And just as they're getting back to the point of having some money in them, they're completely depleted again because the financing structures are not strong enough. So they're just a whole bevy of problems that have really brought this program to its knees.
I think one of the most interesting aspects of the expansion of unemployment insurance to cover pandemic-related unemployment was the fact that the current system simply was not up to date as just a technical infrastructure to really be able to handle means-tested sort of allocation of resources that many people presume in policy would work, right? I would know how much you were earning before this pandemic unemployment, but our systems literally, infrastructure-wise, cannot deal with the volume of the number of people who are seeking assistance, and also simply to administer aid to them and assistance to them in any reasonable amount of time. And that leads to this sort of a follow-up to the things that you were mentioning here. Given this landscape, what can we learn from the past and even current, what I would term policy failures, that would help inform future action? What would be some of the solutions that you see to many of the barriers that you see in this process? So Tammy, you were mentioning, for example, SSI and applying for SSI, but many people outside of the professional setting who might work in that don't understand what that application process is and what it entails and how long it is. So if we can identify those things as policy failures because they don't administer benefits quickly or appropriately, what will be some of the solutions from those mistakes that were made that we can do to revise policy going forward?
Well, talking about SSI specifically, we've been promised for so many years that the application for SSI would be online. and it has not materialized. So if you have a work history and you're applying for SSDI, there's an application online for you, and there has been for quite a long time. And in terms of advocates and advocacy out there, I think there are not enough financial incentives for legal services to help people to actually apply for benefits. There is a national evidence-based practice called SOAR, which when somebody applies on their own, usually people like the population we work for, people who have a disability, who are homeless, when they apply on their own, they have a 10 to 15% chance of getting benefits. But when you use this SOAR method, which usually takes the help of some kind of an advocate, because you've got to collect your medical records in advance, you've got to, work on that application in advance. And in our case, we do the paper application and we do the online application because that will make it faster for Social Security. But there aren't financial incentives to support legal services to help people with that application, even though it would make such a difference. So instead, legal services is focusing on the place where you really have to have a lawyer, which is having a hearing. But you've already been denied after waiting maybe almost a year for your first decision. For states that have an intermediary level of appeal, you're waiting at least a few more months for that. And then to get a hearing takes another year to a year and a half. Who in the world can survive that long waiting for benefits? People, that's why we have so many people couch surfing and sleeping in tents, because they don't, people with disabilities, they don't have this income, and it takes so long to do it. So supporting legal services to help people with applications, I think, would be very helpful. Getting Social Security to use technology to make it easier for the advocates to help people would be great. But also staffing at Social Security alone is a huge issue. Social Security has been starved for so long that they have many empty positions that they cannot fill. They've tried to move to a model where people don't have to go to their office and sit around for hours like people used to have to do. And that's because of the lack of staffing. So in a way, it's taught them something, but there's still a level of staffing below which you just can't go. And so I think that there are a number of things that could be done to really make a difference. And at a bottom rate, we really need to look at the benefit level. The benefit level for SSI, we've known for a long time, cannot buy you housing. Even if you spend 100% of your check, which is just under $800 a month, you cannot rent a place in any county in the country on SSI if that is your only source of income, and that has to change.
Yeah, I'll chime in and just say half of the budget of my organization is raised from private contributions and philanthropy for a reason, and that is so that we can provide those services to homeless people, so that we can actually have a social worker help them with housing applications, SSI appeals, public assistance benefit applications, Medicaid fiascos, et cetera. So there certainly is a lot to be improved with how we help people access various public benefits. But I think I would be remiss if I didn't mention that the single largest group of people who were most immediately vulnerable in the wake of the pandemic in New York City were the informal workforce, the undocumented population, who were literally washed out of their jobs and their homes on the same day. The very first people that showed up on our soup lines were people who had either day labor and rent by the week rooms, or who were working in restaurant kitchens, washing dishes. And they are now living in tents all over the place, hidden. and unable to access many of the benefits that have been provided. As a matter of fact, one of the things we did with so much of the private money that came into us, because New York City was the epicenter at the beginning, a lot of private giving came, and we started out handing out cash cards to people on the soup line so that they could go to what stores remained open, like pharmacies, and buy underwear and buy shoes. So I think that one of the things that is very clear from the last 40 years is that we need to find a way to keep a roof over people's heads, regardless of their immigration status and their income. We've had multiple pandemics in this period. We had, or epidemics, depending on what you want to call them, but we had the period of crack. We had the period of AIDS and tuberculosis, which just ravaged people in New York City. We've had this novel coronavirus killing just unimaginable numbers of people because they didn't have the safety of a place to live safe from the virus. So I think we need to rethink that whole fundamental question of housing as a human right.
In the unemployment program, it's very clear that Congress knows what needs to be done to fix the program, because when we needed to have a stimulus bill in short order when we were hit by the pandemic, lo and behold, Congress passed one that fixed a lot of the problems. So if you just go down the components of the CARES Act, the most critical one to me is the development of the PUA program, the Pandemic Unemployment Assistance Program, which basically provides unemployment coverage to people who have lost their jobs and are not covered by the traditional unemployment system. So it's geared towards people in gig jobs, self-employed people, independent contractors, people who just don't qualify for unemployment insurance because they don't have the W-2 wages. So that program is critical. Second, we have what's called the PEUC program. And I won't even tell you what all these names mean because they're all completely confusing. They all sound the same unless you happen to do what I do on a daily basis. So PEUC basically says the benefits are too short. So we're going to provide benefits for extended beyond the ordinary periods of time. In Pennsylvania, we have 26 weeks of unemployment benefits in regular times. That's not true in many other states where things were cut back after the 2008 recession to shorter durations. Finally, we've got PUC, which is a supplement to the weekly benefit paid by the state. Currently, it's $300. The proposal for the next stimulus bill is $400 a week. You may remember the halcyon days where it was $600 for a bit early on in the recession. And that basically says benefits are too low. And then finally, the CARES Act came up with a bunch more administrative funding, still not enough. All of these programs are still under administered, and that has led essentially to people not getting these benefits. So everybody knows what needs to be done to fix these programs. We could take the lessons of the pandemic. One important improvement we would need to make is that the PUA program, the program that supplements the original UC program, it requires you to have a reason that's connected to the pandemic to qualify for those benefits. And of course, that's not true in traditional UI. So let's say you did originally qualify for a PUA, you found a job, you got into a fight with the boss, now you're fired. They're going to say, sorry, you're no longer eligible because that's not a pandemic related reason. Essentially, we need to expand the original program so that it encompasses everyone. Having a shadow program makes no sense at all.
I wanted to follow up on something that each of you has touched on a bit in your responses so far, which is the federalism that undergirds a lot of these policies today that may not have existed in their original implementation, where there's a lot of state variation in terms of qualifications for programs and in their administration. So can you talk and take sort of a longer time frame of what federalism has meant to people receiving benefits and this now heterogeneous nature of benefits that can be much more generous in certain states than others and have different types of application processes and administration, and what that means to people on the ground in terms of accessing what they might perceive to be wholly federal programs and federally administered programs.
Well, the unemployment program is essentially mostly a state program with a little bit of federalism, federal government oversight out of the Social Security Act. But that's really led to a race to the bottom because all the states are trying to cut benefits more than the next state so they can say, hey, the business environment is best in our state. What we've gotten out of the federal government in recent years has not been good for even the state programs. It's been things like you need to have more fault over payments. You need to make sure people are looking for work. What we're finally starting to see now during the pandemic is something in the other direction where the federalism is actually helping providing some minimum standards. And that's very welcome. And so perhaps if the federal government played a more central role in unemployment insurance, that would lift up the bottom of the programs.
I would say we have a similar problem with public assistance that since welfare reform, which was based on that racist characterization of so-called welfare queens, the public benefits available at the state level are dictated by how the states carve up their share of a federal block grant. And no longer is there a nexus between participating in the federal welfare program for families with children who are poor. There is a arbitrary decision that's made about how we're going to spend these block grant monies, and far too often they go to unproven job training programs. One of the things that's really tragic is that there is a complete disconnect between the evidence base and reality on things like this. So on the job training, true subsidized employment on the job training is a highly effective mechanism to help people leave public assistance for full-time sustainable work. We barely invest in it in any place in the country. Apprenticeship programs, they're just not there. Notwithstanding the fact that you can literally lift people out of poverty and have them in a situation where they no longer ever again need public assistance. Same thing with undergraduate education. These block grants have not brought us the great promise of actually helping the most poor people in the country move out of poverty and into what so-called self-sufficiency.
Yeah, I think as a general rule, what we should be able to expect from our federal government is to set a floor that's not a subfloor, that is actually a floor and that speaks to evidence-based practices, because as we've seen, as Shelly talks about, states left to their own devices are not necessarily going to be doing that. And that is the role I see as the federal government, as making sure that we're providing, all this money is taxpayer money. This money should be used in a way that we know works and has an impact on people's lives. And the federal government can do that by having standards. That's doesn't happen with these block grants. And that, I think, is an absolute role that the federal government should have and would make quite a difference. Now, of course, depending on where you live, some things are better. DC has generally been very progressive and adopted Medicaid expansion before the Affordable Care Act. But that is, I think, the exception rather than the rule, and it shouldn't matter where you live. Everybody, I think, should expect at least certain basic fundamental requirements for these plans, for these programs.
Thank you for that. We know, speaking about the expansion of these programs and their administration, a lot of empirical evidence shows that states are much more stingy with their benefits, the higher the share of African Americans in the population, which goes back to the point that you were each making about the racialization of these policies leading to the way that they're administered at the state level. Moving to the end, and our time is getting a bit limited. We have to talk about the pandemic. We've talked a little bit about it, but I think that's a direct question about the pandemic is absolutely necessary. And so the question is just very simple. In this space, and each of you has been in these areas for quite some time, but now, literally almost a year ago to the day, the novel coronavirus shows up in a pronounced way in your work. So how has the pandemic exacerbated existing difficulties faced by your constituency? So there was already, as Tammy using that language, a subfloor where things were already very, very bad. And now we have this pandemic on top of it. So what did the pandemic do that actually made things even more tenuous for the people that you serve?
I'll pipe in and just say, I mean, for starters, it started almost immediately killing homeless people because our clients, single adults, predominantly at the beginning of the pandemic, were living in congregate shelters. Families with children in our system have, for the most part, private apartment type units with bathrooms and kitchenettes, but the single adults were living in dormitories. And so the age-adjusted mortality rate is much higher for single adults in New York City as a result of the pandemic than the general population. So that is something that has been remedied in part by moving 10,000 people out of dormitory shelters into single and double occupancy hotel rooms, which left the remaining congregate dormitories less densely populated. There is still, every day, my inbox is full of incident reports where people are still testing positive for the coronavirus or are being sent to an isolation facility because their roommate tested positive, and they're concerned about continued spread in both the hotels and the shelters. So we actually filed a lawsuit to require a single room for every single person in those congregate facilities. We think we've read the science. We know the coronavirus is airborne. So there is that problem. We also had to shift homeless families, along with all the other families, to remote learning. And of course, many of the shelters were not wired for internet access, which has left thousands of children with inadequate access to remote learning. And we also are litigating that issue in the hopes that we can improve the access to internet for homeless students. And then access to any number of public benefits, including housing subsidies, has had to shift from in-person support provided by my organization and all of the, the welfare department and all of the agencies of government that help poor people have largely gone remote. And so that meant we worked very closely actually with Doctors Without Borders who came to New York City at the beginning of the pandemic to help. Who knew Doctors Without Borders was going to be helping us in New York, but we formed a really valuable partnership. And they helped us get cell phones for our clients so that we could give phones with minutes on them to our clients so that they could connect with us and other service providers. They helped us set up showers because all of the places where homeless people who are unsheltered would go to the bathroom and take a shower were closed almost immediately. So it's been a very dramatic change in life for homeless New Yorkers. I'd be remiss if I didn't also mention they closed the subways down overnight. And so all the people that were sleeping and taking shelter inside the subways get rousted every night and moved along. And they have offered some hotel rooms for that population, but not nearly enough. I'll leave it there. I could go on.
Certainly, there have been just horrible consequences of COVID. And some states have not wanted to share information about people in certain congregate settings, whether that's nursing facilities, whether that's their jail and prisons. In DC, we've had, a real struggle to get people with who are under the Developmental Disabilities Administration vaccines. So deaths, and it also means, people coming out of prison where everybody knows that COVID is high, don't want their family members feel like they can't take them in. It's not safe. So where can these folks go to quarantine where they're not going to be exposed to COVID? Just so many terrible things. We have been very fortunate, though. I think a lot of funders, private foundations, deserve credit for allowing flexibility so that we could also buy phones or get people additional minutes, because a lot of people can get a free phone. They qualify for that, but it's limited as to how many minutes and how much data you have. And now if people are taking a class, so much is online. That phone is a lifeline for us to try and stay in touch with our clients who are homeless. The lockdown in the jails and prisons means that people are having a great deal of difficulty communicating with us. We're struggling to get legal calls, which should not happen. But it also made me realize that so many people were getting letters written by other people while they were incarcerated, because I've gotten some letters from people that have maybe 6 random words on it. It's somebody I know. And I've seen letters from them before that I thought they had written, but clearly they did not write them. They had someone else write it. And so now that they're writing their own, they can't communicate in a coherent way so that I know, well, what's the need that they have and how can I respond to that? On the other hand, we've seen a great reduction in the census, the daily count at the jail. A lot of jurisdictions have decided, wow, all these people don't need to be in the jail. No kidding. We've been saying that for a very long time. And so a 30% reduction in the jail, and you don't see a huge increase in crime, we can say, hey, you know what? When we're not talking about COVID anymore, we can be talking about changing the rules of the game so that we are not detaining so many people. Like, for example, you can be accused of these technical violations I was talking about before. So no new crime, but you sit at the jail for 4 months waiting for your hearing. If you had housing, you lost it. If you had a job, you lost it. One of my employees, if he wasn't working for me, he would have lost his job. But I held the space because that's what we do. Only to find that there was no finding. So 4 months out of somebody's life, which the system doesn't see as important. It was only COVID that made it seem important. So there are some things I think we can learn from, like these reductions in jails and prisons, people who've been released, and say, why can't we do this every day? These folks obviously don't need to be incarcerated for public safety because it hasn't had a negative impact on public safety.
The state of Pennsylvania likes to say that about 95% of the people who've applied for unemployment benefits have received them, to which I say that is utter hogwash. I was talking with somebody yesterday who is in the middle of it the way I am, and we agreed that we think that perhaps, at least in the PUA program, as many as half of the applicants have not received benefits throughout the term of the recession. Some of them have never received a dime since March. And as much as I've talked about eligibility earlier, this is mostly about administration of the program. And I think that what has happened to the unemployment system is probably going to provide fodder for doctoral students for years to talk about what happened when the program basically had to go from 20 miles per hour to 90 miles per hour within a number of days. I mean, we had full employment before the pandemic started. Within literally days, 1 million people had filed unemployment benefits. And there may have been no stress on administrative agencies that we've ever seen that is comparable to that. And so understandably, they had a hard time dealing with this drastic increase in volume, hiring staff. They had to set up their staff to work from home. And then, on top of it, you add all the new federal programs that they had to operationalize. It was kind of nuts, and I do have to give them credit for having survived it at all. I mean, I don't know what I would have done if I were running a program like that. However, is it fixed? Absolutely not. It is stuck in neutral. The programs are stuck in neutral. Many people are not receiving benefits. To give you a couple of examples of how the administration is bad, there's a complete over-reliance on technology at this point, to the extent that individuals cannot talk to a live person. And sometimes a 5-minute conversation would clear up the problem that a person was experiencing. Just an example, one of my neighbors here came to me and said, I'm not getting my unemployment benefits. I don't understand what the problem is. It turned out that those benefits were being delivered on a debit card that was sitting in the mail in his living room. But he didn't know that. And there was no way for a person to actually reach a live person to find that out. So the over-reliance on technology is terrible. And I'm afraid there's going to be this post-recession fiction about how it worked just fine, and we should keep it that way. Verification requirements. We never had this many verification requirements in the unemployment program as we do now on the PUA side. And many eligible people are being denied benefits. And unlike my friends here have talked about the welfare system allegedly helping people, there's no thought that the unemployment system is helping people at all. My clients get emails that say, here are the half dozen documents you have to provide us, including go to your last employer who may now be out of business and get a letter that said that you were laid off because of the pandemic. So those are really killing people. And finally, the stopping and starting of the CARES Act programs is just a disaster. It's like a major convulsion in the system. And we're about to experience another one because the programs are going to come to an end again for many people in mid-March. And, Congress hasn't passed a bill yet that then has to be operationalized by the U.S. Department of Labor and then has to be operationalized by the state and their computer contractors. So these are all program administration problems that are quite extraordinary.
Congress is broken. And I think that really is leading to so many of these other problems that are happening. They're not looking at anything long-term. Everything is a last-minute crisis fix. And it's hard for anyone to administer, even if they wanted to do well, to administer a program when you don't know what's happening until the last second. And then things change as things go along. And so I think that's something that we all need to think about.
With that thought on our fractured democracy in mind, I want to thank all of you. We were at time, and thank you all for this fantastic conversation. After a 30-minute break, we'll have session 2 with some different perspectives on the contemporary state of needs.
Thank you.
Thank you.